There's a lot happening with New Jersey's child welfare system. We want to help you make sense of it and share our story. This is DCF on the Air.
This is DCF on the Air, and I'm Jason Bukowski. DCF on the Air is a production of the New Jersey Department of Children and Families. Our mission statement at the department is to help all New Jerseyans become and remain safe, healthy, and connected. Notice what I didn't say there. I didn't say all children or all families. Of course, we're focused on children and families. It's right there in our name. And we're certainly not forgetting about our responsibility as a system to serve and support them. But we also recognize the broader impact that environmental factors or community factors or public health factors have on the stability of families and the well-being of children here in New Jersey. As the saying goes, it takes a village. None of us lives in a vacuum. We're all a product of the external influences that happen to us and around us. And so at New Jersey DCF, we're taking a much broader view of how best to support children and families within the context of their communities and their collective experiences by transforming our work, connecting to the community and to our partners, and innovating the practice of child welfare with a more expansive worldview. DCF on the Air is our opportunity to dive deep on some of the transformative work, to talk about our priorities as a system or the evolution of our practice as we seek to provide holistic, proactive, and healing-centered care and support to children and families in our state. Maya Angelou said, "When we know better, we do better." This is our effort to do better as a system by openly talking about our transformation journey. And because we are focused on specifically our child welfare transformation, I think it's really important before we begin to explore different aspects of that, but really to look at it from a 50,000-foot view. So I'm excited to welcome our first guest to the DCF on the Air podcast, New Jersey DCF Commissioner Christine Norbut Beyer.
Yeah, thank you so much for having me. I'm honored to be guest number one.
Great. So let's talk a little bit about the inspiration behind DCF's transformation agenda. I'd like to start with the mission statement, which is it's unique to New Jersey. How was that mission statement developed, and what does it mean to New Jerseyans to become and remain safe, healthy, and connected?
Yeah, thank you. I think, it was really organic, the development of that mission statement. And when we talk about safe, healthy, and connected, now 5 years later, it feels like that's how we're always talking about the work here. And, you see it all over the place, or every speaking engagement I ever do, I'm talking about people being safe, healthy, and connected. But it really started back in 2018 when I first became commissioner and I was being, reacquainted with all of the staff and the programs and, the growth that had happened in the department when I wasn't here. And in meeting with staff in divisions other than child protection and permanency, when I would talk about our goal as a division, as a department for keeping kids, connected through the federal outcomes, and the federal outcomes being safety, permanency, and well-being. Yep. So when I would talk to the other division leaders, when I would say safety, permanency, and well-being, many times I was either met with blank stares, or it was like, oh no, that's not the work of our division, that's the work of child protection and permanency. And so what I realized is that because safety, permanency, and well-being were so ingrained in our dialect and vocabulary to be connected to protective services and child welfare, which was so deeply connected to the Division of Child Protection and Permanency, I really needed to start thinking and talking about how to connect the rest of the department staff and the rest of our programs to this concept of safety, permanency, and well-being. And so really it was just starting to break down, what does it mean? What does safety really mean? What does it mean within CCPMP? What does it mean within the children's system of care? What does it mean within family and community partnerships and the Division on Women? And then the same for permanency. And permanency was really about connections. We do want children to achieve legal permanence, but it's really much broader than that. And so permanency was really about maintaining connections, about developing connections. And again, that's the work of all 4 of our operating divisions and even beyond. And then finally, well-being was where we ended up coming up with the healthy, because it's not just psychological well-being or mental well-being. When we started to think about what does that really mean and how do we begin to parse that out, we want all New Jerseyans to be healthy, healthy connected to well-being, but healthy means, psychologically healthy, physically healthy, emotionally, financially healthy. And so it was all of those various elements that then the other divisions could really connect with. And so, I always talk about it became a riff, on safety, permanency, and well-being. Here in New Jersey, it's safe, healthy, and connected. But what's interesting is other child welfare directors around the country are now, have been talking to me that they are using safe, healthy, and connected because they found that, in speaking that language, they were able to get their judiciary or their legislators to better understand the work of the department.
Now, do you get royalties for that, or is it?
Yeah, that's what I said. I'm like, I can't accept any royalties, or the department can't accept any, but just please make sure you're giving us credit, which, of course they said they would do.
Great. Yeah, I think it really does help to distill down, it makes it a lot simpler, or it makes those concepts relatable to the work of each of our divisions. So I think it really is a great way to kind of springboard into this transformation work. From the mission statement that we developed, we went into our strategic plan in 2019. And this has been a blueprint for transformation. But is this a document that sort of exists in a moment of time, or are we still connecting back to that strategic plan to help guide our transformations as we go through?
Yeah, I think a strategic plan is a blueprint or a roadmap. And so whether you write a strategic plan for 1 year, for 3 years, for 5 years, it really is, as long as the work of the department or the organization, continues to tie back to that or can continue to see themselves in their strategic plan. I think it can be kind of timeless. And so, there are times now where when people say we need to update the strategic plan, it's well, we haven't really mastered all of what was in the original strategic plan. And those concepts and the goals that we set forth for the department, we're still working on them. And so there's opportunities, I think, to always update and tweak and go back and review what was in the original strategic plan, that we created back in 2019.
Yeah.
But I feel like if we're not meeting those goals or we're not continuing to achieve those, then, there's still work to be done.
Absolutely. Can you talk a little bit about our transformation priorities? When we talk about transformation within the context of DCF and New Jersey's child welfare system, what shape does that take in terms of those transformative goals and priorities?
I think that, when we created or begin to lay out the strategic plan, it actually came together on the wall in my office, because I have one wall that's just a huge whiteboard. And as we were looking at, doing an assessment early on when I first became commissioner of the department, looking at our outcome and data, looking at where we were in, the SEP measures and metrics, and, what were the things in the department that we were doing really well, and what were the areas that we still needed some improvement, where there were opportunities for real growth. So I started with that assessment, looking at data, and that's where we started to identify, the number of kids who were coming into foster care and what were the primary conditions and reasons that kids were still coming into care in New Jersey. We began looking at the children's system of care, and while we were serving a significant number of youth, and it was what were we lacking? Where were there are other services or opportunities for growth where we could provide more holistic services for children. And so, I say it started in my office because it was taking all of that information, and whenever it would kind of have an inspiration or an idea, it would go on the wall. And really, the strategic plan started to take shape when we started looking at, the vision of all New Jerseyans being safe, healthy, and connected. Kind of what did that mean? And then, thinking about where were the areas for growth within the department or just areas for improvement. That plus, having worked nationally in between my time at DCF, I had the ability to learn from other systems, to really spend some time focused on best practices, what was the growing edge, in child welfare in the country. And so, where we were in New Jersey, plus taking all of that information and, working at Casey Family Programs, I had access to, what I will say always are like the best minds in child welfare. It was like being in a think tank for about 6 years.
Sure.
And so having the ability to really spend some time thinking about the work, looking at other systems to see where were they achieving or succeeding. And so taking all of that into consideration here in New Jersey, and taking from that lens or using that lens to apply it to our own areas for improvement or our own outcomes. And so then it was like born the ideas and the main goals of prevention that we knew we were spending so much money and time, resource on intervention, deep end intervention in our system. And while New Jersey, has done a lot around prevention, we really knew that we wanted to almost flip the script in the department and that we would start heavily investing in prevention, primary prevention services. So that became one of our main goals. Another goal was kinship and really wanting to increase the number of children placed with relatives. If they do need to come into foster care, we know how traumatic being removed from your parents is, on top of whatever traumas or stress kids are under prior to removal, that, really wanting to maintain their safety and security. And, what better way to do that than keeping children with relatives or friends, people that they know. So that was kinship, that was our second goal. The third goal I talked a little bit about already is the children's system of care and wanting to have a more holistic view of the work there and kind of a whole child health. And then, we can't do any of that work if we don't have a healthy workforce. And so it was really important that we start paying attention to the needs of our workforce, the health of our workforce, doing this work, particularly within CPMP. There's a lot of secondary trauma that staff experience, especially like the longer you're in this work. And so we knew that we wanted to be able to best support our staff so that they could then be their best selves when they were out working with children and families. And so those are really our four primary goals. And I want to say that was organic in a lot of ways also, the development of those goals and then, the objectives and how we went about implementing work in those under those four buckets. But it really was rooted in data and that early assessment of, where we thought there were opportunities to really improve our work and further reform our system.
Yeah. And, the transformative agenda that you just laid out seems to touch on almost every aspect of the work that we're doing right now. How do we find a balance? So we have all of this transformative work that we want to do, but we also have the day-to-day work of the department and updating our processes and making sure that we're meeting the needs of children and families through our existing processes and all this really significant transformation. So can all of these things happen at the same time?
They have to. They have to happen at the same time because otherwise, if you are looking at it in a way that's more linear and saying we're going to take step one, step two, step three, you're limited in how much you can actually accomplish in, what amount of, a small amount of time. In state government, when you're in government positions, you always feel the clock ticking over your head, like how
Very
much
much so.
time in the administration to get things done and really get them rooted solidly. And so the way that we've been approaching it in the department was kind of in three buckets. And the first being service excellence. There are things that we absolutely need to do in this department as part of our federal statutes or state statute, federal statutes or state statutes, regulations and things that govern our work. And in those areas, we want to continue to improve on the work and improve on how we deliver services to families. And so where we don't have a lot of room maybe to say we're not going to do something, like, of course, we're always going to do child protective service investigations, and in order to keep kids safe. But how can we think about doing those investigations in a way that improves the quality of the investigation, improves the experience that the family has when someone comes to their house and knocks on their door? So that's just one example of work we will do that we need to just continue to improve on and get better and better.
Sure.
And then the second bucket is really around reform. And that's what we've been undergoing in this department for 20 years now, I think pretty successfully. But the reform effort is really also looking at what are your processes that currently exist, and then how do you continue to kind of push the upper limits. It's more about taking what you have and continuing to tweak it and improve it, versus the third bucket, which is transformation. And that's where you're really pushing the upper limits, where we're trying things that we've not done before, where we are looking to implement new services, new service types. In many ways, that was the reason for the development of our core approaches, in that we will approach the work differently. And that's an opportunity to really kind of be creative and take from what other states are doing or what other counties are doing or what other industries are doing and see how we can use them here in child welfare.
So you mentioned New Jersey's 20-year reform journey. And that was really launched as a response to the Charlie and Nadine H. lawsuit and federal consent order that we went under as a result. Yeah. And we're right now at a point in our history where we're about to exit that federal lawsuit. So I think that's, really speaks to the success of our reforms. But I think it also opens us up to really refocus on the transformation part of what we want to do. And I was wondering if you could talk a little bit about what work is on the horizon and what some of those transformative pieces that you're really excited about.
Yeah. Thank you for that, for the opportunity to talk about that. And, just for 1 second to talk about the 20-year reform effort. One of the reasons I think we are in a position now to exit the lawsuit, which very excited that, we're getting really close to that, is that in 2018, when this administration came in, we really stopped focusing on doing work for the lawsuit, right? It's like, I think prior to this administration, there was a lot of emphasis on the SEP and doing work for the SEP or trying to meet the SEP outcomes. And one of the first things I did was to say, we're not going to talk about the SEP anymore. Nothing that we do in the department is for the SEP. Everything we do in the department is for kids and families. And so we really need to look at what is the best work or what is going to be the best way to get us to improved outcomes for kids and families. And I think now with, being so close to exit, that in many ways, that really is what made the difference. And so that was a shift in thinking and just a shift in as we were starting to think about what comes next, right? We're not going to be under federal consent forever. And so we have to decide how we're going to do the work and figure out, our own path forward without having the lawsuit over our head and what is that going to look like. And so So I do think that that's a big part of just like starting to shift the narrative and thinking differently about how we do the work. And so with that kind of mindset, it was easy to start thinking more about transformation than reform. Because I think I said earlier, reform is really about tweaking what exists, and it's about, like pushing on the upper limits of existing process, where now we're free to do more, transformative work, always holding true to, what we are federally mandated or, through state statutes required to do around keeping children safe.
Yeah, absolutely.
But it's the transformation of the system is how do we start thinking differently and bringing non-traditional partners to the table, non-government organizations to the table. And, first and foremost, in this administration, we're focused on bringing families to the table. Parents, young people in foster care, kinship parents, parents of children who are getting services from our behavioral health system, because we really need to tailor services and supports to what works for the family. Not that we're just continuing to feed the system and systems get the results that they're designed for. And so we have to start thinking differently about the design. How do we redesign the system to be more effective for the end user?
Yeah. And I think one of the things that you talked about, I really want to kind of dive deeper on, because I think that shared leadership work is so important right now. So I want to dive a little bit deeper on how do we bring those families to the table? How do we bring youth to the table? Families that have those experiences with our behavioral and mental health system. I know one of the key components of our transformative work, it's being led and informed by people who have that lived experience with our system. How important was that for you to incorporate those voices, and how do you do that in a way that yields positive transformation momentum without necessarily, re-traumatizing someone?
Yeah. So I think for me, it was really important to bring parents to the table and young people to the table. Initially, it was to hear directly from them about their experiences with the system, their experiences with, all of the divisions within DCF. And very quickly, through those initial conversations and those initial meetings, back at my first listening tour, it became clear that there was so much powerful information being shared that really did lend itself to the development of the strategic plan and the development of, those initial goals. And so then my thought was, how do we continue to bring those voices to the table? And not that I'm taking their ideas and then within my own mental model, like saying, okay, great, here's a new program now. So I think traditionally that is how systems have gotten the voice of constituents, and is through focus groups or having one or two people participate in a meeting or on a panel. And then we just go back to kind of taking over the ideas within the system. And then the system continues to function as it always has. And so this was really me wanting to be very intentional about incorporating their voices, incorporating their ideas, but then continuing to have parents and young people at the table in the development of a program model. Or, recently we had young people write legislation, and they were assisted in doing that. It's not like, they did it on their own, but it was really a joint effort, and it was more about a shared leadership approach and honoring people's experience in a way that really impacts or informs the work. I think we have better products. We have, more meaningful programs because ultimately the people who need and want the help, if they're designing it, then it's going to be designed to meet their needs. Sure. Versus, someone sitting in a government office trying to determine what's the best service delivery method for, a neighborhood or a city somewhere in the state.
Yeah, and I mean, I was in attendance at some of those early listening sessions, and you definitely get an unvarnished view of the work of the department, and I think that you've done such a great job within DCF to kind of hear the true story of what's happening here in DCF, and not really kind of shy away from the negative aspects of it, but really maintain that positive momentum, saying, okay, I know this is what happened in the past, and I'm not going to apologize for it, but I do want us to be better for it. And I think that's really, I think that's been a byproduct of your work, listening to the people.
Well, and sometimes I do apologize for it, right? Because, I think I don't take offense to when parents or young people talk about their negative experience with the system, or even if it's current or past. If it's current, then of course it's what did we do, what could we do, how could we do it better, what can we be modifying or changing. But when people talk about their experiences, the negative experiences with the system 20 years ago or 10 years ago, I don't take it personally, because I know we were a system that needed reform, and we were a system that, was not providing the best service for families all the time. And that's not to say people weren't doing their best, or we weren't trying to do the right thing or provide the best service, because I think we all in this department come to work every day wanting to do a good job, wanting to do what's right for and best for kids and families. But I think you said it in your opening, when you know better, you do better. Yeah. And there's been so much research over the last 20 or 30 years in the field of child welfare, and so much that we're learning about incorporating family voice, the reason why we should want to place children with kin if they have to go into foster care. And so, we didn't have the data and the research that we have now. And so we know better, and now we're going to do better. And so I can listen to parents say, I had a bad experience with the system, or, your system destroyed my community. I can't disagree. I'm like, yeah, I'm sorry that happened to you. And now you're here with us. And so using that negative experience, or, using whether it was a negative or positive experience, but using that to then inform, improvements, that's what's going to make all the difference. And I think that's why it's so important to incorporate that constituent voice into all levels of our work, and bringing them to the table as partners, as equal partners, getting to the shared leadership. We each have a role to play, but I think our system's going to be all the better for it.
Great. And just kind of going off of that, and this is really my last question, and I think this is probably going to be a recurring theme for the podcast in general, but how important is it for DCF to own and to share our story? And how can we be authentic but remain positive about what the future holds for us?
Yeah, well, we need to own our story. It is our story, and that's like getting to the ugly past also, because that's part of the story. And it's the same way, it's almost like a parallel process when you're working with a family, because a lot of the families that we work with, particularly in DCP&P, we get involved with them at a time that, it was something that they would rather forget, or, at a difficult time in their family, or whatever stressors they were dealing with. And so that's their ugly history, or their ugly truth. And we then work with those families to build strong families, to help support them, to help rehabilitate them. And that's the same thing I think that happens in the system. We have to own that ugly past, or that ugly truths about maybe when we weren't doing as well as we could have been, and recognizing that there's always room for improvement. There's always ways to do things differently. And so it is important to own that. but not dwell in that space. And because I think that's where you can get stuck in the cycle of, well, the system's all bad or the system's negative or we need to abolish the system or do away with it, when in reality, it's not the entire system. There are pieces that maybe we want to do away with or we need to change. And so, being authentic about, that knowledge and that understanding to then say, I own that, I accept it, and now we're going to move forward from there. But I'm always happy to talk about our whole story because it's the journey and the transformation. You can only talk about the accomplishments and the achievements, and they're that much sweeter when you also factor in, where you came from and maybe the dark days.
Sure. And I think that's really important, is to own it, to recognize what came before, and to move forward. And I think that's really what we're doing as a system right now. So I thank you for all that you're doing to move us forward, to really kind of give us that vision as a department to unify everybody and then move us in the right direction as a system. So thank you.
Yeah, thanks. Thank you.
I know this is just the beginning of the conversations that we're going to be happening throughout our system, and we hope our audience enjoys hearing from our leaders who are propelling this exciting work forward for children and families here in New Jersey. So on behalf of my producers and the entire team at the DCF Office of Communications and Public Affairs, again, this is Jason Bukowski. Thank you for joining us, and tune in next month for DCF on the Air.